Here's the COVID response. Chinese hospital was, from the very beginning, has been directly involved with the rest of the San Francisco public health and working with the CEOs and the CMOs and the other emergency departments who are on regular calls. We're constantly comparing notes on what our capabilities and our capacities are, what we need to do. Here at Chinese Hospital, early on we prepared by creating plans for cohorting patients. When we got to certain surge levels, we planned on setting aside certain floors to take care of COVID patients so that we are not intermingling COVID that are potentially sick and non-COVID patients. Fortunately, we haven't had to do that because we've had several COVID patients and we've had many what we call PUIs, or patients under investigation. But we haven't had enough to reach that threshold that we needed to separate them. Our engineering, for example, was able to make all of our rooms negative pressure. We've constantly been in contact with people, making sure that we had enough PPE levels. We were able to get certain equipment that we previously didn't have. Improved point of care ultrasound that we can use for diagnosing COVID at the bedside so that we don't need to use CT scans, for example. A glide scope specifically for intubation that makes it safer for the provider, because they're able to sit away from the patient when they intubate, as well as for the patient, because it increases the likelihood of successful intubation on the first attempt. These are all things that the hospital's provided for us so that we can provide better care. And then our lab, for example, we now have testing in-house for COVID that we can get the test back in about 2 hours. Still under validation. We're working with Stanford to validate that, but we are actually testing patients that come in. We get the results for the COVID test within about 2 hours here at Chinese Hospital, and that's been constantly evolving. We started out doing all of our tests through public health, and then we were doing Quest in public health, and then we were doing Stanford, and now we're doing in-house testing. So they've done an excellent job with